Assalamu alaikum friends, welcome to my channel MBBS and BDS lectures. Today our topic is related to special surgery, physical examination of appendicitis. Before this video, I already made two videos about appendicitis. In first video, I was explain the definition and surgical anatomy of appendicitis. In second video, I was explain the causes and sign and symptoms of appendicitis. But in today video we will study about physical examination of appendicitis. When we examine the appendicitis patient, which physical examination, which signs are present in the patient. Before going to explanation, if you want to watch the same lecture in Urdu Hindi, I already upload the same lecture in Urdu Hindi on my YouTube channel. Go and watch that video. But if you want to watch in English language, then this video is for you. Now today topic is physical examination of appendicitis. When we examine the appendicitis patient, which signs we find during the physical examination of appendicitis patient. The first sign is tenderness. Tenderness at McBurney point. In second video, before this video, we already studied about McBurney's point. The point from 2/3 distance when move from umbilicus toward ASIS, anterior superior iliac spine. The point is called McBurney point. Or when we move from AS to umbilicus, the point from 1/3 distance toward the umbilicus from ASIS, the point is called McBurney point. Now the first sign is when we find during physical examination of appendicitis patient, tenderness at McBurney point. Second sign is rebound tenderness. Rebound tenderness also occur at McBurney point. In rebound tenderness, first we press the right iliac fossa site and suddenly leave the site when inflamed appendix touch the posterior wall of abdomen, then pain is produced. This is the mechanism of rebound tenderness. We press the right iliac fossa, and when we suddenly leave the right iliac fossa, the inflamed appendix touch the posterior wall of abdomen. In result, there will be rebound tenderness. In result, there will be pain at McBurney point. The third sign is pointing sign. Pointing sign, patient point with his finger to the site of maximum point. What is pointing sign? Patient itself point by its finger the site of maximum pain. Where patient feel maximum pain, patient itself put its own finger on the site where he or she feel the maximum pain. This sign is called pointing sign. Patient point with his finger to the site of maximum pain. This is called pointing sign. The fourth is rousing sign. Rousing sign means when we palpate the left iliac fossa patient, the pain produced in the right iliac fossa. Now, to understand this mechanism, how when we palpate the left iliac fossa and pain produced in the right iliac fossa, the mechanism behind this process is that when we palpate the right iliac fossa, the organ of right iliac fossa move toward the organ of left iliac fossa. When we palpate the left iliac fossa, the organ of left iliac fossa move toward the right iliac fossa, and when the left iliac fossa organ move toward the right iliac fossa, and these organ touch with the inflamed appendix in right iliac fossa, and result there will be pain. This sign is known as rousing sign. The fifth is source sign. P is silent. What is source sign? Extension of thigh elevate pain and flexion of thigh decrease pain occur in RC appendix, retrocecal appendix. Meaning retrocecal appendix, when we patient extend the thigh, the pain will be elevate. And when patient cause flexion up, flex the thigh, in the result there will be pain decrease. This is known as source sign. Mean in retrocecal appendix, when patient extend the thigh, the pain become alleviate, the pain become increase. And when patient flex the thigh, the pain will be decrease. This is known as source sign. 6 is Dumpy sign. What is Dumpy sign? When patient during cup, when patient feel cough, and when a patient feel cough, due to cough the intra-abdominal pressure become increase, and intra-abdominal pressure become increase, in the result there will be right iliac fossa pain. Mean dumping sign, when patient feel cup, due to cup the intra-abdominal pressure of patient become increase, and in the result there will be pain in the right iliac fossa. This is known as Dumpy sign. 7th is obturator sign. What is obturator sign? Medial deviation of hip increase pain. When patient medial deviate its hip, in the result there will be pain, and this pain occur in pelvic appendix. When the tip of patient are present in pelvic region, when patient do medial deviation of hip, in the result there will be pain. This is known as obturator sign. Medial deviation of hip increase pain and occur in pelvic appendix. The 8th sign, the last sign, is Markle sign. What is Markle sign? When patient standing on toy, no pain in the right iliac fossa. When patient standing on heel, pain in the right iliac fossa. Mean when patient standing on toy, no pain in the right iliac fossa. When patient standing on heel, pain in the right iliac fossa. These are the 8 signs which we find during the physical examination of appendicitis patient. Number 1, tenderness at McBurney point. Number 2, rebound tenderness at McBurney point. Number 3, pointing sign. The point patient itself tell where patient feel maximum pain, and this point the patient point by its finger. And 4th is rousing sign. Mean when we palpate the left iliac fossa and pain start in the right iliac fossa. And the 5th is source sign. Extension of thigh elevate pain and flexion of thigh decrease pain, and it occur in retrocecal appendix. And the 6th is Dumpy sign. Mean during cup the intra-abdominal pressure of patient become increased, and in the result there will be pain in the right iliac fossa. And 7th is obturator sign. Mean medial deviation of hip increase pain, and it is occurring pelvic appendicitis, pelvic appendix. And the 8th is Markle sign. When patient standing on toy, no pain in the right iliac fossa. When patient standing on heel, pain in the right iliac fossa. Now today our topic is complete, in which we study physical examination of appendicitis, and during physical examination we find these 8 signs. Now in this is the 3rd video of appendicitis series. In 4th and 5th, which is last video, we will study the investigation and management of appendicitis. Now today our topic is complete. If you like my video, press the like button and share this video with your friends. If you new to my channel, subscribe my channel by pressing the red subscribe button, and also press the bell icon to open the notification for receiving my each new video notification. For watching my videos, I am very thankful to you. Thank you very much.